Again, here we see that Kerala is in the higher prevalence rate here compared to the other states. They also did compare rural to urban areas, and also here the age standardized 10-year risk of cardiovascular disease event is comparable, is also highest in Kerala. It's not dependent on rural or urban areas. Now that, so far, that is the bad news, of course, for our Keralites. But what is the good news? Good news is we have possibilities to prevent heart disease. And that's what I would like to focus. That's absolutely important. How can we prevent heart attacks? How can we look that we do not get a heart attack? So what are the risk factors? On one side, we have non-modifiable risk factors. These are age. With advanced age, of course, the risk of a heart attack is higher. We have the gender. Male gender has a higher risk for heart attack than female gender. We have family history of heart attack or genetic predisposition. For all this, we cannot do anything against this. This is a non-modifiable risk factor. But we have a lot of modifiable risk factors like smoking, cholesterol, high blood pressure, diabetes, the so-called sugar disease, obesity or overweight, lack of physical activity, and stress. If you look again at this one of these studies, then you see here again the high blood pressure rate, the prevalence of high blood pressure is highest in Kerala compared to other states, and also high cholesterol level is the prevalence of high cholesterol is higher in Kerala than in other states. So it's really not only that the disease is higher, but also the risk factors are higher in Kerala, unfortunately. These are again some images, figures from that study. You see here, left upper side here, the mean body mass index, which is an index showing as the obesity, the overweight. Again here, Kerala and Punjab are the first and the second states with the highest body mass index. Means systolic blood pressure is high in Kerala, and also high blood glucose prevalence. This is in Tamil Nadu and Kerala are the highest blood glucose prevalence. Looking at the smoking prevalence, this is good news. This is quite low, especially in female. This is female. These are the male, especially in female. This is really, really low throughout India, and this is absolutely a good point for India, that the smoking prevalence is low. Now, what can we do? If someone is smoking, of course, stop smoking. That is number one. Lower high blood pressure. What can we do here? Reduce salt intake, reduce the salt in the food. That can help to reduce high blood pressure. What else can help to reduce high blood pressure? It's to be physically active. So we recommend to be physically active every day, 5 times a week, if possible, for 30 minutes, because being inactive contributes to high blood cholesterol levels and obesity. It's also important to reduce weight if you're obese, and to reduce stress if somehow possible. And one important point is also choose good nutrition, healthy food, which is absolutely important. What is healthy food? And that's what I'm going to talk about right now. Good and healthy food, especially are fruits, vegetables, fish, some nuts also. You see here the so-called healthy eating pyramid. These are the food that we can eat without any problems, while these are the food like sugary drinks, sweets, red meat, white bread, white rice, that should be reduced in our daily routine. And also you see here fish is preferable. Fish is better than meat, especially red meat is not recommended that much. And of course, vegetables and fruit should be in our daily clinical in our daily routine, and whole grain products like brown rice, whole wheat, pasta, and oats. That are all food that should be included in our daily food routine. Now let's move on to the heart disease treatment. If someone has heart disease, what are we going to do as doctors? So coronary angiography, you probably have heard about this. So you see here what we are doing as cardiologists. We are putting a catheter here to the artery. We go up to the heart and put the catheter into the artery, and you see here the block. We can look at the block. You see here one of this image from one coronary angiography, and you see here this is a normal vessel. This is again a normal vessel, but in between you see here the block. It's quite narrow here at this place, so this is the so-called block, an ischemic heart disease. For many years, the only option we had if someone came with this block is to do a bypass surgery. This was the only option with an open heart surgery. What is a bypass operation? A bypass operation is we put an artery, an external artery, or the left intramammary artery into the artery after the block. You see here, this artery is put here after the blockage in the coronary artery. So for many, many years, bypass surgery was the only option we had. Now, in 1977, Dr. Andreas Grünzig, he was a professor and a doctor at University Hospital in Zurich, and that's why we are very, very happy and very proud, of course, as cardiologists at the University Hospital in Zurich, because he was the first one worldwide. He performed the first coronary angioplasty. He invented the balloon dilatation, so the first angioplasty was performed in Zurich, Switzerland. So you see here this coronary artery with the block here. So he introduced this new technique. He went with the wire here, this block area, and put a balloon like here, so that this artery is expanded again, so there is no block and the blood is flowing again normally. So that was in 1977. After that, of course, this technology developed again and again, and nowadays we have this so-called coronary angioplasty stents. So first of all, we go there with a wire, we put a balloon there and dilate this coronary artery, and after that we put the stent here into the coronary artery. You see here how small this stent looks like. So that's the treatment of a heart attack. The heart attack in patients with heart attack, they should go to the ER, to the emergency department very soon, and to the ER where a coronary angiography is possible. And this is the final treatment of a myocardial infarction or a heart attack. And of course, patients will receive also medication after that. Now, a little bit to close my talking about the modern approach to heart disease. What do we have right now? We have modalities to prevent and to early detect ischemic heart disease. So this is my focus area, cardiac imaging. So you see here a CT, computer tomography, you see a PET scanner, an MR scanner, and also the ultrasound. And we can also combine all these different modalities. We can assess images of the heart without going into the heart. Just looking from outside of the heart, we can assess images of the heart. And this is how it looks like. So this is a 3D heart computer tomography. So this patient came to our department, and we performed computer tomography without going or doing any surgery. We can look at his heart. We can do a 3D model of his heart by a computer tomography. You can clearly see also here the coronary arteries. Now this is how it looks like. This was one of my patients. He's a 45-year-old male patient with chest pain, and we performed the computer tomography. This is at our institution, the computer tomography, and you see here you can see the calcification, the block here in one of these vessels here. There's a block. This is another patient of mine. He had a little bit more severe blocks here. You can see here at the beginning of this artery, there's a severe block here with calcification here in white, and we also have the possibility to go through to go like a movie through these coronary arteries and to see where there is any block. Again, this is quite a young patient in our department. We performed a CT and we could see there are several blockages here in these coronary arteries. So this white one is the normal blood flow, but you can see here the block here in the beginning of the coronary artery. So it's possible to detect coronary artery disease at a very early stage. Of course, we can combine different technologies. We have here on the left side, you see an ultrasound image of a heart. This is what I'm doing every day, looking at the function of the heart, looking how the heart is beating. And here on the right side, you see a combination of a CT and a PET image. So we can look exactly where there is no blood flow, there is a reduced blood flow, where there is a block, and so on. So this is quite an important tool we have nowadays. And again, here some recent advances we can combine ultrasound technology with CT technology, and there's also a huge potential in detection of heart disease with new imaging technologies. So coming to the conclusion, heart disease is a leading cause of death worldwide. People in Kerala, unfortunately, are at highest risk of heart disease in India. And prevention, but the good news, of course, as I said, the prevention of heart disease is possible, like this diet, physical activity, and that's absolutely necessary. And it's important that people, that they are aware of this. The awareness of people in Kerala, in our home country, is absolutely important. And of course, new cardiac imaging technologies for early detection of heart disease is increasingly available, not that much in India, but more and more, and of course it will also be available soon in India, I believe. With this, I would like to thank you for your kind attention. This is the University of Zurich. You see the beautiful lake of Zurich with the mountains. This is the place where I'm working. And thank you very much once again for the kind invitation. And I will give back the word to you, Dr. Sonia Marcos.
Ma'am, I have a question. Good morning, sir. I'm Hina from the Department of Physics. So I have got a question for you. How would you rate the Indian cardiac care setting in the global context?
Sorry, I didn't ask the first part. The global?
How would you rate the Indian health system, particularly in the context of cardiology, in the global context?
I really believe that the Indian health system is quite good, especially in Kerala. We have a lot of very, very well developed hospitals and also very good doctors in Kerala and in India. But I think it's the awareness of this heart disease or disease in general is a bit lower than in other countries. But I believe the health system, in fact, is quite good in India. And we have, of course, the advanced technologies also in India, in different hospitals I visited during my visits in Kerala.
Thank you, sir.
I have a question, doctor. I'm Dr. Xavier.
Yes, please.
I have a family history of heart diseases. My father had an attack last 15 years ago. His brother and sister died due to heart diseases. Now, I would like to know how this family history will affect my health, whether I can take any precaution to prevent this heart diseases.
Yes, very good question, and absolutely important. And I think this is absolutely important because you should be aware. I mean, the risk is higher, as I said in my talk. Uh, family predisposition is one of the risk factors. We cannot do anything. This is genetic, but we should take precaution. We should have checked our heart. We usually say it's around in the age of 40 or more, we have to check our heart with a cardiologist to see if everything is fine. So there are possibilities to check the heart, to look at the laboratory, to look at the blood cholesterol level, for example, the blood pressure. That's absolutely important, especially if you have if you know that there are persons, people who have had heart attacks in the family. You should be aware that the risk is higher for you or also for siblings to have a heart attack, and it's absolutely important that we go to the cardiologist and let's check the blood pressure. We can check a lot of laboratory measurements like the cholesterol level. We can also look at the blood pressure level. We can look at the exercise tolerance you have, doing a bicycle exercise test. So that's absolutely important. I would really recommend to do this, and of course the cardiologist would recommend to do or to take any medication if that is necessary. We have good medications, in fact, to reduce cholesterol. These are the so-called statins. That is really helpful to reduce cholesterol, in fact.
Thank you, doctor. Thank you for the suggestions.
So I have got one more question.
Yes, please.
Is there any female specific disease which can increase the risk of women's risk in heart diseases?
Female specific, that is an absolutely hot topic right now in cardiology. There are a difference in gender. We know for long times around, I mean, the heart disease study started 50 years back in the 1950s, 1960s. And for a long time, almost all patients who were included in the studies were male gender patients, because of course male have a lot more heart attack, but the heart attack is different in women. They have different symptoms, and we know that nowadays, and this is a hot topic in our community, in our cardiology community, the difference between women and men, and how different the risk factors are, but also how different the signs of a heart attack, the so-called typical heart attack signs like chest pain, and so this is not that usual in women. It's quite a little bit different. They have more abdominal pain or atypical pain, we say this, and so on. So that is an absolutely important topic, and I think in the coming years there will be more and more studies on the difference between men and women in heart disease. Right now we don't have much information on the difference about the risk factors, but still there is quite a lot of research going on in this area.
Thank you, sir, and it was great connecting with you.
Thank you.
Thank you, Sonia. Am I audible?
Yes.
Respected Principal, Dr. Sister Gigi Janama Xavier, the Chief Guest of the Day, Dr. Aju Paul Parankotil, Vice Principal, Dr. Sister Stella, Program Conveners, Dr. Sheena Xavier and Ms. Sonia John Marcos, dear friends and students. Good afternoon, one and all. The upsurge of an institution's progress is dependent on the head of the institution. And St. Xavier's College for Women Aluva is blessed with a great leader in our principal, Dr. Sister Gigi Janama Xavier. She always gives the spur to embrace and initiate programs that will benefit the staff and student community. It's her strong support that works as a mainstay of all our endeavors. Thank you, dear sister, for being our linchpin and our anchor. There is a saying, life is lived to the rhythm of your heart. The adage itself says the importance of the care we should give to the caring of our heart. Today, we had a comprehensive session on all the terrains of knowledge regarding heart and heart care. For such an extensive and inclusive talk, we are much indebted to Dr. Aju Paul Parankotil, the cardiac consultant and lecturer, Zurich, Switzerland. Sir, you have taken us deep into the heart of things and made us understand how to take care of our heart. On behalf of the Xaverian fraternity, let me express my words of gratitude to you, sir. Thank you so much.
Thank you very much. Thank you.
In the context of the pandemic, the webinar series on health is a welcome program as it will help us know more about physical fitness and healthcare. The webinar series is the brainchild of Dr. Sheena Xavier, our IQAC coordinator, who is always in the saddle to organize whatever that would benefit the institution. Her enthusiasm is a stimulus to all to move forward without cease. Thank you, Dr. Sheena. May I also place on record a hearty gratitude to Ms. Sonia John Marcos, the joint convener of the webinar series. She is the person who identified the right resource person for this session. Thank you, Ms. Sonia. My thanks are also due to Ms. Shruti Francis of the Department of English for the technical support rendered. Thank you, Ms. Shruti. May I also thank all the faculty and students who participated in this session. I do hope that the webinar will positively benefit all of us in terms of heart care. Thanking one and all once again. Thank you so much.
Thank you very much. Thank you for the kind invitation again. It was really nice to be here and to be part of the webinar.
Thank you, Dr. Aju.
Thank you. Bye. Hope to see you in Aluva maybe sometimes.
Yes, sir. ഫീഡ്ബാക്ക് ലിങ്ക് ഇട്ടിട്ടുണ്ടായിരുന്നു കേട്ടോ സോണി. I think his father is here. Matthew